Across the UK.
This is BBC 5 Live, the Emma Barnett Show.
Good afternoon. From today, anyone in England who defies an order to self-isolate can be fined between £1,000 and £10,000. It's now illegal for anyone who's tested positive for coronavirus or those who've been contacted by NHS Test and Trace to refuse or breach quarantine. After falling from their April peak, confirmed new coronavirus cases in the UK have been rising again since July. On Sunday, the country recorded 5,693 new cases. Dr. Duncan Robertson is an academic at Loughborough University and an expert in modelling and policy analytics. Welcome to the programme.
Morning, Emma.
Are the measures we currently have working?
Well, it's very difficult to say because, of course, in order to answer that question, you need to know how many cases are out there. And one of the problems that we have is that with the demand for tests outweighing the capacity, we don't really know how many cases are there. So we can see it rising, and this is what's been warned about by for several weeks. So I think, in short, no, it's not working.
What do you think needs to come in or change?
Well, I think the government needs to take advice, and of course, the chief scientific advisor has some of the world's experts in both modelling and behavioural science. And really, the government needs to listen to and to hear what those advisors are saying. I think, someone said a couple of decades ago, advisors advise and ministers decide, but I think the advisors aren't being heard at the moment. So, for example, if you think about what we heard about closing the pubs at 10 o'clock, there's going to be a reaction to that. People are going to, just go to supermarkets after 10 o'clock or just shift their day back by an hour. So really, all these sort of things are predictable and have been predicted, and I think the government needs to listen to advice.
And if they were listening, what would our lives look like?
Well, that is the policy decision, and that's the very difficult thing that governments have to weigh up. And I think, you can look at it from an economic perspective and you can try and keep the economy open, or you can look at it from a health perspective and try and minimise cases or minimise deaths. But I think what's not happening is people aren't looking at the whole thing as a system that, it's not one or the other. You have to look at it holistically. And so, Professor Van Tam, the Deputy Chief Medical Officer, said back in May, if you release all these things too quickly, it's going to take off. And that seems to be what's happening. So the politicians have to decide what has to go, and whether that's restaurants or pubs, but it seems that the policy is to keep schools open, and that's the priority. So that's a political decision, and politicians really need to tell us what they're doing and why.
But is that because we have seen in some places, for instance, there's indications in Wales that local lockdowns are having an effect?
Well, I think, essentially this virus spreads by people getting in close proximity to each other. And so, the Chief Scientific Advisor confirmed in his briefing with the Chief Medical Officer that it's airborne transmission plays a role as well. So if, people are indoors, in close proximity, for example, in university accommodation, then it is going to spread. So, if you can stop that spread, then the virus is going to, if you can stop that transmission, the virus is going to slow down. And that's what we're trying to do. We're trying to get this R number below 1 and to prevent it going out of control and rising exponentially.
It's just not that simple, is it? Because of how we live and how we live our lives and that bigger question. Or do you see it as very simple? Let's have another lockdown till there's a vaccine,
No, I think, as I said, you need to look at it in terms of a balance between the economy and the science, and you need to look at these things as a whole. And that's why these experts are there within SAGE who can advise about the modelling of how the epidemic is predicted to take off. And they can also think about the behavioural effects in terms of how people are going to react to be told, you're going to have £10,000 fines, for example.
Do you think we've made a good enough use, I'm sorry to break in there, of behavioural scientists and behavioural economists?
It's a resource that the government can use, and of course there was some talk at the beginning of some advice that perhaps wasn't mainstream, but essentially, you can predict what's going to happen, and the government needs to listen to behavioural scientists and modellers and take their advice. I think the point is, if you're going to defer if you're not going to take that advice, you need to say why you're not doing it. And I think that's a step that's missing.
So right now, should we be even having a nightlife?
Well, I think, people can have nightlives in lots of different ways. I think, what is happening is that there is this transmission. And, you can think about, is it a problem of 20-year-olds? And, of course, that is how it has been spreading. But now it's throughout the entire working population, and it's going to, the over 80s as well. So there are 22 cases per 100,000 amongst the over 80s. And the point is, it's not my risk, it's other people's risk. So I can't really answer whether I want a nightlife for myself. I have to think about, and perhaps government has to step in here and to take the bigger picture and say it's not just my risk I'm taking on, it's the risk of society.
We've got a message here. I wondered if I could read to you from Brenda, who says, "Hello, our Five Live. After what happened to my elderly mother, who tested positive twice after 13 days in a major hospital where she couldn't have visitors or even flowers, I'm convinced this virus is everywhere and there's no point trying to resist it anymore. My mum's off the oxygen now, but she's weak, confused and still unvisited." As I say, that's from Brenda. What would you say to her?
I would say, it's an awful disease, this virus, and I think we should be blaming the virus. But, there are incidents in care homes. So last week, 195 incidents were reported in care homes. And so the problem is that this is a disease of the old and the vulnerable are most susceptible to that. And, it's an awful situation that everyone finds themselves in. So I can't answer for other people. Of course I can't. But, we have to look at it in terms of it's not just the reaction it has on me, but it's what happens to other people. And I think if we keep that in mind, we're not going to go too far wrong.
So do you also agree? I mean, I was speaking to Professor Peter Openshaw last week from SAGE. He didn't believe that the government had gone far or further enough with restrictions across England. And he actually also said that 2 weeks would be too long to wait to change it about households mixing, because also, getting this right quickly is key. What's your view on that?
Well, I think there are two things. One is, the science is out there. So I think on the 14th of July, the Academy of Medical Sciences published a report about what the reasonable worst-case scenario is. And it's very sobering reading. And the other thing I would say is this isn't a problem where you take the information that you have at the moment and then react to it. It's not sort of a kind of a polling type thing where you're trying to keep all the people happy all the time. In operations, we call this a bullwhip effect, which is basically what we're seeing now is a result of policy 3 weeks ago. And of course, if we wait another 3 weeks, we're going to, this virus is going to stay out of control until people intervene.
Dr. Duncan Robertson, an academic there at Loughborough University and an expert in modelling and policy analytics. Thank you.